Another very common question for us, both in clinic and also in the forum, is the time at which people should test. So currently there's a certain amount of confusion about the testing times. So currently we have a 10-day test which will identify very early onset HIV using a PCR. And then we have the combined HIV antibodies and P24 antigen. And then we have just plain straightforward antibody HIV testing. What's your opinion about those three?
I think all the tests that we now have available for testing HIV have a distinct role to play.
Mm-hmm.
The least distinct of those three tests that you mentioned is the HIV PCR test. We use HIV PCR testing for testing what we call viral load, and it's an integral part of managing and monitoring HIV tests when we know we have patients with established infection. But the 10-day PCR test that is offered, notwithstanding its cost, is actually not really diagnostic enough to be able to give a very accurate answer. And you would still have to use conventional testing at an appropriate time point to give you a definitive answer.
So what you're really saying there, what Mervin's really saying there, I think, is that the PCR test would give a good indication, but in comparison with the other HIV tests, it's relatively poor.
Exactly. I think that if that test was positive at around day 10 to day 14, there is no question that the person will have been exposed to HIV.
Mm-hmm.
But if it's negative, you would not be able to say without any doubt that you were fine. Okay. Whereas the modern duo test, which is measuring HIV antibodies and what we call HIV P24 antigen. HIV P24 antigen is a protein that is released or is part of the viral makeup and is released into the bloodstream, and it is positive in patients who are exposed to the virus from about 2 weeks after infection. And so the combination of P24 antigen with early antibody detection is a very, very sensitive way and very specific way of actually making an early HIV diagnosis. So from 2 weeks to about 6 weeks after an exposure, the HIV duo test would be an excellent test to do. After that period of time, the likelihood of a fully fledged antibody response, i.e. an immune response, your immune system has made antibodies to the virus, it's detected that it's there, and it now has an established immune reaction, then the standard HIV rapid test, which just looks for HIV antibodies, would be a perfectly reasonable test to do as well.
Very commonly, patients will ask whether, you mentioned the P24 antigen, and the P24 will, as you say, form at around about 2 weeks or so. It tends to stay at a very high level, I think, for maybe 8 or 10 weeks thereafter. Would you agree with that?
The P24 antigen levels. It does. The P24 antigen levels go up and up and up throughout the course of HIV infection. And they tend to plateau at around about 6 months.
Yes.
And that's almost in parallel with what we now call the HIV viral load, which is measuring the amount of HIV genetic material detectable in the blood of the patient.
I'm glad you said that, because the very many sites on the internet will say that P24 will begin and peak at around about 2 weeks, stay constant maybe for 3 or 4 weeks, and then disappear completely as the immune response comes in. But certainly my experience and my thought process on that is that the P24 will form and will remain at a high level for a period of time, the first 3 months or so, but then will fluctuate through the remainder of the course of the illness.
That is indeed the case, because as I mentioned, P24 antigen is part of the virus.
Yes.
And as the virus continues to replicate in the body, it continues to make more P24 antigen, which obviously just plateaus as the viral set point is reached. And by viral set point, I mean when the body reaches an equilibrium, the immune system's trying to control the viral infection and the virus is trying to replicate. And so eventually a happy medium is set, and at that level the P24 antigen would probably stabilize. What is interesting in this conversation, though, is that P24 antigen is no longer used as a marker for viral progression or progression of viral disease, because we now use PCR technology, HIV viral load testing, to do that very job with much more accuracy.
And the reason for that, obviously, is that the tests have progressed, technology has advanced, and whereas P24 was a useful tool in its day, exactly, we've now moved on to something else.
And its main role now, its only role now really, is in the detection of early infection, yes.
So Mervyn, the key question for me, if I was a patient who'd had a recent very high risk exposure, say I'd had a condom break with somebody who I knew was HIV positive, which test will be the best test for me to have? And bear in mind that I've had this episode, say, 2 weeks ago.
Yeah, so that's a very important point. 2 weeks is a critical point, I think, in terms of HIV testing. Before 2 weeks, the use of the HIV PCR test is not well established and probably is not good enough to make a specific diagnosis. At around about 2 weeks, given the current sensitivity and specificity of the HIV duo test, where it's looking for HIV antibody production and it's looking for HIV P24 antigen, that test becomes more and more useful, especially if you've got symptoms. Because if you are symptomatic from an early HIV exposure and then you do that test from about 2 weeks onwards, you are likely to pick it up using that test. The current guidelines for the use of the HIV duo test is to test around about day 28 to maximally pick up antibody production and P24 antigen production.
But I'm going to go away on holiday on day 26 and I need to have it done before I go away because I want that security. So
I think that at that sort of time frame, if you were likely to have been infected, it would be positive.
Okay.
The guidelines around testing at 3 months after an exposure are really because of the fact that the early HIV tests that were used were not as sensitive, and so concerns were raised about the ability to pick up very low levels of antibody production, and so very early infections and very late infections might be missed. But the modern tests are so sensitive that any antibody production is going to be picked up relatively easily with the HIV duo test, and in that regard, testing at around 4 weeks is fine. If you don't and you're feeling okay and you decide you're going to test later, that test is still going to be accurate.
Because the P24 is still going to be detected.
P24 antigen is still going to be detected months after infection, as are the antibodies.